Good morning and welcome to Radio Friends on Wednesday, January 30th. We're going to talk about a special kind of medicine today, something that we all have within our power to administer to ourselves, and that is exercise, right? And I want to introduce you to Dr. Mary Dohrmann, who is the director of the Cardiology Clinic and Cardiac Rehab at University of Missouri. Good to have you here.
I'm delighted to be here.
When you walked in today, that's how you described exercise. You said it is medicine, right?
Well, exercise is medicine, and without it, we have more disease and more difficulty recovering from the problems we do develop in life. So if I could write a prescription for any one person, all ages, doesn't matter what problems you have, physical activity and exercise really is preventative and in some circumstances, I think, curative.
Cures it?
Well, if you think of things like depression, sleep disorders, weight management, high blood pressure, all of those things are improved with exercise.
Right. As far as the mood swings, too, it releases endorphins, right, that
Absolutely.
make us feel better.
Yeah.
How do we know when we're getting enough exercise? If we think we're exercising, how do we know it's enough, or we're just kind of fooling ourselves?
Well, I think that in modern life, we're tending to sit more. And honestly, I think sitting is almost like not doing everything you can to enjoy life. So getting up, moving around, getting in your steps is one thing. That's the movement aspect. But then there's strength. So you have to be strong, and then you have to be able to endure. So you need really all three.
Okay.
You need to be up and moving. Then you need to build up your muscles, and then you need to use them to endure. And the approximate time you'd want to be exercising is about 30 minutes every other day, about 150 minutes a week for literally everybody.
You don't have to do it every day.
Not necessarily.
30 minutes every other day. But if you do it 30 minutes a day, that's even better.
Absolutely. So the more, the better. Actually, if you exercise more rigorously, so that you're maybe exercising 300 minutes a week instead of 150 minutes, you get double the benefit.
Yeah. Going for a nice 1.5 mile, 2 mile walk, that's good.
Movement is great, getting steps is great, but you want to gauge it by are you able to walk and talk? So just very mild breathlessness as you're out there.
Okay, so you want to work up to that, right?
Absolutely. And This is what I recommend for the older individual who hasn't exercised in a long time is build your muscles first. Even chair exercises help, and do what you can. Not everyone can get out there walking rigorously, and even people who are homebound and chair-bound can chair exercise and shadow box and dance in your chair.
You're never too old.
Never too old.
Never too old to exercise. Doctor, thank you so much. If people want more information on this, what's the best place to go?
Well, I think that the MU Healthcare website is very helpful. But in terms of cardiac rehab, the number is 882-4283, and we'd be glad to answer questions about exercise.
That's very nice. All right. But remember, the important thing is to get out and even if you got snow on the ground, if you can't get out, walk around the house.
Yeah, or dance in your chair.
All right. But be careful shoveling that snow if you haven't done it for a while.
Absolutely.
Okay. Dr. Mary Dohrmann, thank you so much for University Healthcare.